Okay, so thank you for attending today's webinar. Today's webinar topic is for Digital Health Technologies Convergence for Hospital at Home and Phygital Care. So here, Phygital Care that I bring from another industry, actually, the phygital means the physical and the digital, the virtual. So actually, it represents somewhat, there was a popular language term was metaverse. Actually, I was very active in metaverse. So in a metaverse is a place actually in a virtual and physical space coexist. And then people has their own digital identity called the avatar. And then they are digital twin of the person, and then they interact with each other. So I just bring the terminology in here, but the phygital means the current trend, the based on this digital technology that patient can be cared in the virtually. So usually the telemedicine is one example. So just it's naturally that the phygital term is not used up to now in healthcare, but it's already this kind of the terminology actually is in place in healthcare area. Okay, so we have a full big agenda. So I'm going to introduce about the hospital at home and physical care for holistic healthcare. And I'm going to talk about the current status of the digital health technology landscape ecosystem and how to integrate digital health technology to this area and how to implement. Okay, so if you look at chat, I share the link to the presentation that I posted in my LinkedIn. So you can see the presentation later for details. So the content I prepare this is a big topic. So I prepare a lot of different things to cover the whole topic, but I'm going to introduce hospital at home and physical care for holistic health care. So it's better to start in, okay. Okay, so first, the CMS Acute Hospital Care at Home program. So it is the CMS to support the reimbursement through this program to many hospitals actually join and provide that I'm going to explain later for detail. And then the how it can be evolved. So evaluation of the hospital at home. And then I'm going to show that my intensive study research over digital health ecosystem. And then I provide you what the current status and the digital health powered hospital at home. So traditional hospital at home will be powered by digital health. So usually digital health technology convergence for real life use case that actually it was one of the pilot through the CMS Act hospital care program. So that was a hospital at home in heart failure management and XR power hospital at home. So the XR means extended reality. The virtual reality is a common term. So you will see that how this XR can bring hospital at home at the next level. So I will show you XR powered hospital at home and then a real life use case that actually that done in the like a virtual reality training experience for home care professionals in the Mass General Brigham, the medical Excel lab to the researchers actually work on that in real life use case. And then I'm going to show about the synergy in integrating digital health technology for hospital at home and physical care. And I will show you several demo videos actually created. And then finally, I'm going to touch how to implement. Okay, so hospital at home is, as this term means, means that hospital in home, right? So but the currently the program support the acute system. So I'm going to talk about acute the healthcare for the CMS, but actually they can do either acute or chronic care in the home. So it a lot of the like value, like reducing hospital stays and healthcare cost and improving patient comfort, right? And then particularly digital health technology like telemedicine and remote patient monitoring is play a role to make this as a very advanced level that you can have the patient-centered care at home. And so here is like a home visit. It also like not just a telemedicine, and actually doctors can or nurse can visit to your home so they can be integrated with the virtual and physical care. So that's why I introduced term Phygital. And the CMS Acute Hospital Care Home Program it is started at the time of the COVID-19. And then you know that there are a lot of the like hospital have a problem, especially emergency room or the care of the like some like defected or the affected the patient to care in the right time. So CMS in collaborative government agencies, they started this program. And then so you can see this site. They have a lot of resources. And the current status is that as of today, that there was a hospital at home program is 365 CMS certified numbers. So that means that you can provide a code number can be like reimbursed through this system. And then 138 health system and in 39 states actually, and particularly for Mass General Brigham and Mayo Clinic and Mount Sinai Hospital System is one example to join this program. And then key driver, yeah, patient-centered care, the cost-effective, and technology integration, scalable flexibility. There are many advantages that bring this as the government and CMS like initiated program. And hospital technology, in this case, there was a medical in the academic medical, like a medical school in like a lady, like a Mass General, and community hospital, like a Mercy Hospital South kind, and health system, Cleveland Clinic is one example, and specialty hospital, and Mayo Clinic, Arizona, and then rural and regional hospital. So there was very active, but the currently the what happened is that actually this is a temporary act. So it's initiated by the emergency situation. So this will be expire at the end of this year. So the policymakers make this as permanent, and then now they're working on the restoration, but not sure yet. But anyway, because it is very advantageous, so uh, even the CMS individual, like there are many ways actually the individual like the payers can be involved in addition to CMS. So so there are several like overcome challenges like interoperative regulatory compliance, rural access, something like that. But anyway, it's a very promising area we can explore. So this is the one actually. Recently, I tried to the I really have delved into this health area for a year. Actually, the last month was the 1 year anniversary. Actually, that I decided to really delve into in this health area. And then I really intensively studied and researched about the whole scope of digital health and from technology and business model and initiative and even the patent. And I'm a patent attorney. And also like next week, I'm going to talk about regulatory framework and reimbursement and many things. And then I found that one big topic that I want to be in a more like a deep level involvement is how to make this digital health as a mainstream healthcare. So I did several steps, and then also I developed my own innovative way to do how to, for example, recently that I developed the platform to adopt the like DTX is early stage to be included in the mainstream healthcare workflow. And I filed a pattern with my partner, and we did a webinar about the starting of to how to implement and then and produce a pilot. And another thing that I was found is that this is also the hospital at home. The physical care is another the good opportunity that the health technology can be integrated with the traditional the healthcare service to provide another like offer more better way to provide the health service. So that actually the digital health the naturally can integrate with the traditional like a mainstream healthcare. So that's why I choose this topic to talk about. So so I decided to first that how to let other people know about my intentions. So I did several ways, but actually this is one way that I recently I found that I found try to like to ex like let other people know about what I think about my insight to be as a demo video. So I'm going to show you that the way actually that to explain what is the hospital term can be evolved. So this is a type of the storytelling about what happened.
In the early months of the COVID-19 pandemic, hospitals across the US faced an unprecedented crisis. Patient beds were rapidly filling up, healthcare workers were stretched thin, and the risk of hospital-acquired infections was soaring. Amid this chaos, the Hospital at Home waiver program, initiated by the Centers for Medicare and Medicaid Services (CMS), emerged as a bold new approach to healthcare. It allowed hospitals to provide acute care directly in the patient's home while still receiving Medicare reimbursements. This shift was more than just a temporary fix, it was the start of a revolutionary new model for healthcare delivery. A new landscape in healthcare by Q3 2023. The program had expanded to an impressive 365 approved CCNs, CMS certification numbers, spanning 138 health systems in 39 states. Health systems that had long been viewed as giants of innovation, like Mass General Brigham, Mayo Clinic, and Mount Sinai Health System, were early adopters of the model. They showcased HU's potential to enhance patient care, reduce costs, and alleviate strain on traditional hospital infrastructure. This model fundamentally redefined what healthcare could look like. Instead of patients being tethered to a hospital bed, they could now recover in the comfort of their own homes, surrounded by family and familiar surroundings. For hospitals, the benefits were clear: reduced hospitalizations, fewer unnecessary tests, and lower costs associated with traditional inpatient care. It was a win-win for both patients and healthcare providers. Key drivers of hospital at home adoption. The model's success can be attributed to four major factors. 1. Patient-centered care. At the heart of the program is the belief that patients recover better in familiar environments. By receiving care at home, patients experience less stress, have improved mental health, and in many cases, recover faster. Families can remain close to their loved ones, and patients can avoid the loneliness often associated with prolonged hospital stays. This personal connection and comfort are powerful drivers of the model's success. Studies consistently show that patients overwhelmingly prefer to recover at home rather than endure extended hospital stays. 2. Cost effectiveness. The model also brings considerable cost savings. A study from 2019 found that hospitals using this model saw a 38% reduction in healthcare costs. This was due to fewer lab tests, imaging studies, and specialty consultations, elements that often drive up the cost of traditional hospital care. The savings allowed hospitals to allocate their resources more efficiently, while simultaneously reducing the risk of hospital-acquired infections, which further drove down costs. 3. Technology integration. A key enabler of is remote patient monitoring, RPM. Through wearable devices, healthcare providers can continuously track patients' vital signs, ensuring that any medical concerns are quickly addressed. This technology, backed by AI-driven analytics, allows doctors to monitor patients remotely with confidence. Virtual check-ins and telemedicine visits ensure that patients are never truly isolated, even as they remain at home. The seamless blend of human care and technology allows HAR to deliver hospital-level care in a home setting. 4. Scalability and flexibility during times of crisis, such as the COVID-19 pandemic, hospitals were forced to think creatively about how to manage bed shortages. The HAR model provided a scalable solution, allowing hospitals to expand their capacity without needing to build new facilities. HAR has proven to be a versatile tool for managing patient care during times of high demand. As healthcare continues to face challenges with resource constraints, HAR will likely remain a key solution for expanding care capacity. Hospital categories in the HAR program. The hospitals participating in the CMS Acute Hospital Care at Home program can be divided into several categories, each contributing to the program's growth in unique ways. Academic medical centers like Massachusetts General Hospital and Stanford Healthcare are often at the forefront of medical innovation. These institutions have used their expertise in research and teaching to successfully integrate HAR, leveraging telemedicine and advanced monitoring technologies. Community hospitals such as Mercy Hospital South, Mo, and Prisma Health Akoni Memorial, SC, have adopted HAR to bring high quality care to local populations. These smaller hospitals play a vital role in extending HAR to underserved areas. Health systems, including major players like Cleveland Clinic and Atrium Health, have used HAR to serve diverse patient populations across state lines. These systems are ideal for scaling HAR, offering a blueprint for how the model can work across different regions. Specialty hospitals focus on treating specific conditions. Institutions like Mayo Clinic, Arizona have found HAR particularly effective for managing chronic conditions at home, allowing patients to receive specialized care without the need for hospitalization. Rural, regional hospitals such as Claiborne Memorial Medical Center, LA, have integrated HAR to ensure that patients in remote areas receive acute care, helping to close the healthcare gap in underserved regions. The future of hospital at home. As of Q3 2023, the CMS waiver allowing hospitals to receive Medicare reimbursements for HAR services is set to expire at the end of 2024. Although policymakers are working to extend the program for another 5 years, the long-term future of HAR remains uncertain. If the waiver is not extended, hospitals may face challenges in continuing to offer home-based acute care. However, if made permanent, HAR could significantly reshape the US healthcare landscape. The potential for providing high quality, cost effective care to patients in their homes, particularly in rural and underserved communities, is immense. But there are challenges to overcome. Interoperability. For HAR to work at scale, healthcare systems must ensure that electronic health records, RPM technologies, and telemedicine platforms are fully integrated. Seamless communication between different systems is essential to the program's success. Regulatory compliance. As HAR expands, hospitals must navigate a complex web of state and federal regulations. Ensuring compliance will be critical to maintaining the program's sustainability. Rural access. While urban areas have seen rapid HAR adoption, rural areas still face barriers, such as limited broadband access, that make it difficult to implement RPM and telemedicine. Bridging this gap will be a key challenge for expanding the program. A glimpse into the future of healthcare. The Hospital at Home Waiver Program has proven that acute care can be delivered safely and effectively outside traditional hospital settings. As technology advances and patient preferences shift toward more personalized care, the hospital at home model represents a powerful vision for the future of healthcare. Whether it becomes a permanent fixture in the US healthcare system will depend on overcoming regulatory, technological, and infrastructure challenges. If successful, the hospital at home model will redefine how we think about hospital care, moving it from the sterile confines of a hospital room to the warmth of a patient's home.
Okay, so that's what I create to currently to demo that what is meant by the hospital at home and what is the current status and the future. So I'm going to talk about what the current status of the digital health ecosystem. Actually, I look at the more than I just look at maybe more than 1,000 startup and globally, and then I just look at the in the default level and select, and then finally select about 480 around the 500 startup in all different area to look at what the current status in the future direction. So I look at the medical diagnostics and digital therapeutics and remote patient monitoring and telemedicine, home care, and clinical trial, real-world evidence, and drug discovery. So you will see all thing that I actually posted in my LinkedIn. So this is one big feature that currently, today I'm going to focus on this one, like so home care environment and then different type of the like a digital health technology can be play a role, but actually in the bigger scale that here is a supporting, so healthcare supporting area. Then this is a service provider area. This is a patient area. So you can think about the ecosystem and the value chain, and they are interrelated. So I have I just actually the did all type of the different type the webinar to explore whole different area and how they can be integrated. So I have seen in detail about every segment of the medical diagnostic remote health monitoring and DTX is particularly I have a deep dive analysis. Recently, I did this one as a quarter 3 update and telemedicine, home care, clinical trials, ultimately drug discovery. So based on this, actually, I also produced this video to whatever the digital health can be power hospital at home that we have seen before.
John, a 72-year-old with a history of chronic heart disease, had always been wary of frequent hospital visits. The stress of long hospital stays, the separation from his family, and the constant fear of readmission had left him anxious about his health journey. However, everything changed when his healthcare provider introduced him to the hospital at home model powered by Digital Health Technologies. One day, after a routine checkup, John's physician noticed concerning fluctuations in his blood pressure. Instead of admitting him to the hospital, John was enrolled in the hospital at home program, allowing him to receive hospital level care right in his living room. A day in John's new healthcare experience as John settles in for the day, he puts on his wearable device, a simple but powerful tool that continuously monitors his vital signs such as heart rate, blood pressure, and oxygen saturation. This device seamlessly transmits real-time data to his healthcare provider's centralized dashboard, where a team of clinicians tracks his health. If any red flags appear, they're notified immediately, and AI-powered analytics predict whether his health might deteriorate. This way, his care team can act preemptively, adjusting medications or treatment plans before any serious complications arise. By the time John's grandchildren arrive for dinner, his remote patient monitoring (RPM) system has already provided updates to his care team. Rather than spending the evening in a hospital bed, John enjoys the comfort of his home, surrounded by family. Telehealth plays a crucial role, allowing John to have a virtual consultation with his doctor to review his daily data, make necessary adjustments to his medications, and answer any questions. This blend of technology and personalized care gives John peace of mind, knowing his health is being actively monitored, even from a distance. Technology-driven, personalized care for John, the hospital at home model has completely transformed his healthcare experience. The AI-driven analytics integrated into his care have not only flagged potential health risks, but have also helped shape a personalized care plan tailored to his unique needs. Thanks to predictive analytics, his care team can assess patterns in his data, allowing for early interventions that prevent hospital admissions and improve his overall health outcomes. Even more importantly, John feels empowered. He uses the interactive patient portal to track his health metrics and follow educational modules that help him understand his condition better. This keeps him engaged in his health journey, a factor that has proven to lead to better adherence to treatment plans and improved self-management. Addressing social determinants of health, SDOH beyond John's medical care, the HAR program recognizes the significance of the social determinants of health, SDOH. John's care team understands that his recovery isn't just about medication, it's also about his living environment, his access to resources, and his emotional well-being. With tailored interventions that consider these factors, the healthcare team has ensured that John's home environment is optimized for his recovery. They've even connected him with a local community centre that offers activities and social support for seniors, further enhancing his emotional health and overall well-being. The bigger picture, the hospital at home model doesn't just benefit John. It is a scalable, cost-effective solution for healthcare systems struggling with high patient volumes and limited hospital capacity. During the COVID-19 pandemic, hospitals were often overwhelmed, highlighting the urgent need for such models that free up beds while still providing high-quality care. For patients in rural or underserved areas, how extends the reach of specialized care that would otherwise be inaccessible. Moreover, the data integration across RPM, telehealth, and digital diagnostics provides a more comprehensive view of each patient, enabling proactive, personalized care that improves outcomes and reduces the strain on healthcare systems. A new era in healthcare, John's story is just one example of how the digital health powered hospital at home model is transforming patient care. With its focus on patient centered, proactive, and personalized care, this model empowers patients, reduces hospital admissions, and promotes better health outcomes. By addressing not only acute medical needs but also chronic care management and preventive health, the hospital at home model is leading the charge in a new era of healthcare, one that meets patients where they are, at home.
Okay, so next up, this is a real life use case of digital health integrated this hospital at home program. So it is from the recent study by CMS about actual use cases. And for the first one, actually, as this project was initiated, the talk about some kind of like a cough related, like some kind of like a in the like COVID-19 related like pulmonary kind of the care, but the second one was related to cardiovascular care and particularly heart failure management. So this is the that.
Imagine John, a 68-year-old retiree, living with congestive heart failure, CHF. For years, John's condition has caused him multiple hospitalizations, disrupting his life and leaving him anxious about his health. Each trip to the hospital means days away from his home, endless monitoring, and a slow road to recovery. This cycle of hospital visits and stress only makes his condition worse. But John's care takes a new direction when he is enrolled in a hospital at home (HOP) program, a model of care that integrates advanced digital health technologies. This marks the beginning of a significant shift, not only in how John manages his heart condition but in how healthcare is delivered to thousands of heart failure patients. The beginning. Hospital stabilization and transition home. John's journey into the HOP program starts at the hospital. After another episode of heart failure exacerbation, John is admitted, where the medical team begins diuretic therapy to manage the fluid overload causing his shortness of breath. Typically, this would have meant a long hospital stay, but now, once stabilized, John can go home, without losing access to hospital-level care. A team of healthcare professionals assesses him and decides that John is stable enough to transfer to the HA model. At home, he is equipped with several RPM devices, including a wearable ECG monitor, a blood pressure cuff, and a bioimpedance sensor that tracks fluid retention, critical in monitoring his heart failure. The digital health platform overseeing John's care is connected to these devices, streaming his vital signs to his care team in real time. This immediate access to data means that if there is any shift in his heart rate or fluid levels, the care team will know before a crisis happens. Day-to-day monitoring and care for John. Every day starts with a simple routine. He checks his weight, logs his symptoms, and puts on his RPM devices, all from the comfort of his living room. The devices do the rest. His healthcare team, which now includes cardiologists, nurses, and digital health specialists, monitor him remotely. If his weight increases by more than 2 pounds over a short period, a sign of fluid retention, an alert goes off in the system. Within minutes, a nurse contacts John to discuss his condition and, if necessary, schedule an immediate home visit or virtual consultation. Unlike the frequent, impersonal checkups he was used to, these interactions are frequent but not disruptive. John can easily speak with his cardiologist over a video call if his symptoms change, and his care team is always a click away. The RPM system acts as an early warning network, catching signs of deterioration far before John would have noticed on his own. This constant surveillance and real-time feedback foster a sense of security for John. He feels empowered, engaged with his own care in a way that was never possible in a hospital setting. With the digital tools providing him real-time updates on his heart function, John becomes an active participant in his treatment. No more guessing whether he needs to tweak his diet or medication. The data guides him. Predictive insights and personalized interventions. The convergence of telehealth, RPM, and data analytics brings more than just remote monitoring. John's data isn't just tracked, it's analyzed. The system's AI algorithms analyze trends in his heart rate variability, fluid retention, and other key health metrics. Over time, the system can predict when John might be heading for another exacerbation of heart failure, days before he feels any symptoms. For example, John's heart rate variability changes slightly, and his fluid levels begin creeping up. While these changes seem minor, the system predicts a possible decompensation event. John's cardiologist reviews the data and decides to adjust his medication immediately. This intervention prevents another hospitalization, and John continues living his life at home without interruption. These data-driven insights provide John's care team with powerful tools to deliver precision medicine. Instead of a one-size-fits-all approach, John's treatment plan evolves as his condition changes, ensuring that he is always receiving the most effective care for his specific condition. His diuretics are adjusted based on real-time data, and his care team monitors the effectiveness of each change without requiring him to step foot in a hospital. The broader impact, efficiency and accessibility. John isn't just benefiting from this model on a personal level, he's part of a larger movement in healthcare. By reducing unnecessary hospital admissions, the HA program conserves critical hospital resources, freeing up beds for more acute cases. For every John who can be treated at home, there is another patient whose urgent condition can now be managed in the hospital. This HA model is also a game changer for patients living in rural or underserved areas, where access to specialized cardiac care is limited. John's cousin, living in a remote part of the state, also suffers from heart failure but has never been able to consult with a cardiologist regularly. With the HA program, John's cousin now uses RPM devices to track his condition and engages with cardiologists through telehealth appointments, eliminating the need for long-distance travel to access quality care. The future, a new standard of care. John's story illustrates the potential of the hospital-at-home model, especially in complex, chronic conditions like heart failure. By integrating telehealth, remote patient monitoring, and AI-driven data analytics, the HA model isn't just about making care more convenient, it's about fundamentally improving how care is delivered. This convergence of digital health technologies not only empowers patients like John but also equips healthcare providers with the tools to deliver personalized, precise, and proactive care. The HA model creates a future where chronic heart failure, once a condition defined by frequent hospitalizations and uncertain outcomes, can be managed effectively at home, with fewer hospitalizations, fewer readmissions, and better quality of life for patients. As the healthcare landscape continues to evolve, the hospital-at-home model offers a glimpse into a future where the home becomes the primary setting for chronic disease management, empowering patients, optimizing resources, and setting a new standard for heart failure care.
Okay, and then I'm going to talk about another topic. This Excel, they usually not much touch in the when you talk about digital health technology, usually the AI powered like other digital health is a mainstream. But actually the Excel, the extended reality is a really powerful digital tool to make this happen in a more advanced level. So so basically, what you mean is that they provide immersive environment in like a virtual 3D environment, whether it's like a purely virtual or the mixed, in the virtual and physical, or the overlay of your virtual to the physical, like they call augmented reality. So this is a one big topic in recently in the healthcare area to apply in many different area. And I'm particularly interested in how they can be applied to hospital at home. So if you look at this one, you will see that what is application of Excel for the hospital at home.
Dr. Alex, a tech-savvy physician with a passion for innovative healthcare, and Nurse Jenny, a skilled and compassionate nurse, are about to embark on an extraordinary day of providing care for Mr. Thompson, a senior man recovering from surgery. Today, they will also be training a new intern doctor, Sarah, on the latest cutting-edge technology in healthcare, the XR-powered hospital at home. It all begins in the immersive virtual environment where Dr. Alex and Nurse Jenny don their VR headsets. Using advanced 3D scanning and photogrammetry, they enter a fully replicated digital twin of Mr. Thompson's home. From their remote location, they can virtually walk through his living space. Nurse Jenny points out the risk areas for falls in the kitchen and living room. Together, they review Mr. Thompson's mobility needs, suggesting the relocation of a few items and adding safety equipment near his bed and bathroom. Through mixed reality, Dr. Alex projects a 3D model of Mr. Thompson's knee, recently operated on, to explain the healing process to Sarah, the intern. Sarah watches as Dr. Alex overlays the 3D image into the virtual home, showing how the knee's movement will be monitored in real time during rehabilitation exercises. Nurse Jenny walks Sarah through the mobility and accessibility optimization they've recommended to reduce the strain on Mr. Thompson's knee as he recovers. Real-time monitoring and XR-enabled interventions. Meanwhile, in the background, Mr. Thompson wears a set of non-invasive remote patient monitoring (RPM) devices. These IOMT sensors track his vital signs, heart rate, oxygen saturation, and glucose levels, continuously transmitting the data back to Dr. Alex and Nurse Jenny in real time. Dr. Alex pulls up the data, displayed on an augmented reality interface, and immediately notices a spike in Mr. Thompson's blood pressure. With the XR-powered system, he quickly adjusts the care plan and communicates directly with Mr. Thompson via a virtual consultation. The senior patient, sitting comfortably in his home, is reassured by the personal care being provided without the need for a hospital visit. Sarah, fascinated by this seamless integration of real-time data, watches as Nurse Jenny conducts a virtual nursing session. Using AR, Nurse Jenny remotely guides Mr. Thompson's daughter, who is his caregiver, through the proper administration of medications and explains how to monitor his vitals. This XR-powered interaction ensures continuous care while empowering Mr. Thompson's family to take an active role in his recovery. Simulated training and emergency response. As part of the intern's training, Dr. Alex initiates a simulated emergency response using XR. They virtually simulate a scenario where Mr. Thompson's blood pressure drops suddenly, requiring immediate intervention. Dr. Alex and Sarah practice the steps to stabilize Mr. Thompson, reviewing the use of complex medical devices in the simulation without any risk to the actual patient. The hands-on, immersive nature of the XR training provides Sarah with the confidence and skills needed for real-life scenarios. Additionally, Nurse Jenny walks Sarah through the use of Mr. Thompson's ventilator, showing how XR technology provides an interactive, step-by-step tutorial on managing the device in real time. In this virtual training environment, Sarah can repeat the procedures as many times as necessary until she's proficient. A new era of care. By the end of the day, Dr. Alex, Nurse Jenny, and Sarah have provided comprehensive, patient-centered care to Mr. Thompson, all through the XR-powered hospital-at-home model. Mr. Thompson remains comfortable in his home while receiving high-quality, personalized care tailored to his needs. Sarah, the new intern, has learned hands-on techniques and gained confidence in the use of advanced medical technologies, all in a safe, immersive training environment. For Dr. Alex and Nurse Jenny, this day represents a glimpse into the future of healthcare, one where the boundaries of traditional hospital care are broken down, replaced by an accessible, efficient, and immersive approach that keeps patients engaged and cared for in the comfort of their homes. This XR-powered care model not only enhances the quality of care for patients like Mr. Thompson but also transforms how future healthcare providers like Sarah are trained and prepared for real-world medical challenges.
Okay, so next topic is real life application of XR powered hospital at home. So this is the construct by me based on information provided by the Elena. She's actually the one of the key researcher in Mass General Brigham Medical Extended Reality Lab. So she developed this XR-based training system for nurse to particularly targeting the home care personnel.
Imagine stepping into the shoes of a home care nurse, where you are tasked with managing patients who may require oxygen therapy, remote consultations, and constant monitoring, all from the comfort of the patient's home. Now imagine being able to practice these complex tasks in a virtual world before handling them in real life. This is precisely what Eleni K. Balasau, Med, and her team at the Mass General Brigham Medical Extended Reality Lab, MGBMXR, have brought to life through immersive virtual reality, VR, training for home care professionals. In her role as Multimedia Program Manager for Radiology and a founding member of MGBMXR, Balasau is at the forefront of integrating cutting-edge technology into healthcare education. One of her key initiatives is the development of an immersive VR training module designed specifically for home visiting nurses. This VR experience creates a 360-degree, 3D training simulation that mirrors the complexities of real-life home care settings, where nurses face a myriad of challenges, from monitoring vital signs to integrating telehealth tools for virtual consultations with doctors. A new dimension of training for home care nurses. This VR training scenario is not just a technological marvel, it has fundamentally transformed how home visiting nurses are trained. The scenario provides a realistic environment where a nurse interacts with a tablet for telehealth consultations, a pivotal tool in the modern healthcare landscape. Nurses can engage in simulated remote consultations with physicians in real time, allowing them to collaborate seamlessly without the patient needing to leave their home. This mirrors real-world situations where the nurse would use telehealth during patient visits to quickly consult doctors, ensuring that critical healthcare decisions can be made on the spot. As part of the immersive experience, nurses also practice taking vital signs, such as using a pulse oximeter to monitor oxygen levels. This builds practical, hands-on skills that are essential in home care, where nurses must be proficient with equipment and able to monitor patients autonomously. Simulating complex care scenarios. The VR training goes beyond basic tasks to simulate more complex patient care scenarios. In one scene, the nurse is shown performing a physical examination, including chest assessments on a patient who is undergoing oxygen therapy. This part of the training heightens the stakes, requiring the nurse to make real-time clinical decisions based on the patient's condition, exactly what would be required in a real-life home care visit. The immersive nature of VR allows for these more intricate scenarios to be practiced in a risk-free environment, providing nurses with the opportunity to build confidence and refine their clinical judgment. What started as a demo project for a software company quickly grew into something much larger. The educational quality and production value of the VR experience surpassed expectations, leading to its official adoption as the primary training tool for home healthcare professionals. Nurses trained with this technology emerge better equipped to handle the complexities of home care, including integrating telehealth technologies into their everyday practices. They are trained not only in clinical skills but also in how to communicate effectively with remote physicians, all while managing the unique challenges presented by a home care setting. A broader vision for XR in healthcare. The Mass General Brigham Medical Extended Reality Lab, MGBMXR, founded in 2020 under the leadership of Professor Rahul Upat, MD, is dedicated to leveraging extended reality, XR, technologies like virtual reality, VR, augmented reality, AR, and mixed reality, MR, to revolutionize healthcare education and clinical practice. Through its work, the lab is creating immersive tools that improve patient experiences and help clinicians develop their skills in safe, controlled environments. The lab's broader mission is to explore how XR can transform not just medical training, but patient care and clinical workflows, providing a glimpse into the future of healthcare. The VR-powered hospital-at-home training program designed by Eleni Balasau and her team exemplifies this vision, offering a compelling real-world use case of how immersive technologies can enhance medical education and ultimately improve patient care. By empowering home care professionals with these advanced training tools, MGBMXR is helping to shape a future where telehealth, remote monitoring, and immersive training are seamlessly integrated into everyday healthcare practices.
Okay, so this is one good example that how the digital health technologies can be integrated with the traditional, the mainstream healthcare. Okay, so I'm going to talk about next topic. So the why we think about integrating different type of the digital health technology, the synergy, yeah, the telemedicine as a gateway for remote care, and RPM is enable early detection, and digital diagnostics for the ensuring timely and accurate medical interventions. And digital therapeutics enable personalized interventions and additionally the home care for the comfort at home. So these different the component usually that the treaties before as even with the digital health professionals, now we need to think about how they actually can integrate in a synergetically bring the more value to the traditional healthcare, mainstream healthcare system. So that actually they can adopt naturally to as a mainstream healthcare. So this is one thing that I'm thinking about strategically that approach how to make digital health a mainstream healthcare. Okay, so this is the one probably uh not much time to see all things. So I recommend I will stop in during the prayer, but I will give it a snapshot. But you will see that I show the link here.
Imagine a patient named Sarah, who has been managing diabetes for years. Traditionally, her treatment involved monthly clinic visits for monitoring and adjustments, often leading to stress, logistical hurdles, and delays in her care. Now, with the integration of telemedicine, remote patient monitoring, RPM, home care, digital diagnostics, and digital therapeutics, DTX, Sarah's healthcare journey has been transformed into a seamless, holistic experience, delivering care to her doorstep, both virtually and physically. The story begins with Sarah engaging in a telemedicine consultation from her living room, where she virtually meets her healthcare provider. Telemedicine, acting as the digital gateway to her care, eliminates the need for frequent clinic visits while keeping her in direct, real-time communication with her doctor. This interaction is just the first step in her comprehensive care journey. Behind the scenes, remote patient monitoring, RPM, takes center stage. Sarah wears a continuous glucose monitor, CGM, linked to her smartphone, providing her care team with real-time updates on her blood sugar levels. This constant stream of data is analyzed by AI-powered algorithms, identifying any potential health risks or abnormalities, allowing Sarah's doctor to intervene early, before her condition worsens. The wearable technology Sarah uses isn't invasive, it's a part of her daily routine, giving her the freedom to live her life while staying connected to her healthcare. Now, what makes this story even more impactful is the role of digital therapeutics, DTX. Alongside her RPM, Sarah uses a DTX app that provides evidence-based recommendations, dietary guidelines, and even behavioral support for managing her diabetes. This app doesn't just send reminders, it offers personalized interventions, helping Sarah manage her condition more effectively while improving her adherence to treatment. Next, we see the value of digital diagnostics. AI tools in the background analyze her continuous health data, spotting early signs of complications that a human eye might miss. These diagnostics, especially in chronic disease management like diabetes, allow Sarah's healthcare team to adjust her treatment regimen in real time, leading to better outcomes and minimizing the risk of hospital admissions.
Okay, so I saw that this is will be happen in the future because one thing that I have seen that the RPM is yeah already used by many different type of the healthcare application, in particular in like the hospital at home project. And yeah, digital diagnostics already yeah adopted in many different area in healthcare system. And DTX is early stage, but as I mentioned that I recently I like to have a webinar to actually to make this has happened that I developed with my partner about to how to make DTX as a mainstream workflow so that doctors, not even that when they see the patient and then diagnose something, and then when they make a treatment plan, actually they will consult not only the traditional therapy, including prescription drugs, but actually they can prescribe the DTX as a part of the treatment plan. So we develop platform actually can be included in this kind of like everyday doctors and patient interaction workflow to include digital therapeutics. And and this is another one actually. In the future, that everything will be done in remote. So including telehealth and remote patient monitoring and every virtual care will be done because of this AI power. So I will just show you the selection.
Imagine a world where patients no longer need to wait in long hospital lines or travel miles for care. Instead, they can receive personalized, high quality healthcare right from their homes. This is the promise of AI in remote healthcare, a revolution that is changing the landscape of patient care as we know it. Through seamless integration of artificial intelligence into telehealth, virtual care, and home care, the system is becoming more proactive, personalized, and efficient, reshaping how healthcare is delivered in today's fast-paced technology.
So you can see my video about the last part of it. Actually, I tried to bring every enable digital health technology currently available to be included in this journey. So whatever the future remote healthcare by this AI-driven revolution. So I recommend you look at. So final touch. Yeah, this is a final agenda, how to implement, right? So yeah, we need many different like steps required to actually this can happen. But actually in implementation, we need to infrastructure development and data integration, patient care training, and collaborative care teams, and regulatory compliance, and other many things we need to be done. And it should be done in a collaborate in the multiple stakeholders to take place. And then I wish that I'm be a part of this endeavor that this is happening in the future that this the fascinating digital technology can integrate with the traditional healthcare, including this hospital at home program and other remote care that actually to bring the our healthcare is a more like a more another layer, another level, the healthcare that actually that they can like fundamentally to the dealing with the three big topic challenges in healthcare, the cost, accessibility, and the value, right? So I hope that that'll happen in the future. So for the regularity stuff, it's just the next week, I'm going to talk about some regulatory reimbursement framework because I'm also I'm not just a developer and the innovator and the businessman. I'm also an attorney. I'm a training in law school and I'm a New York State attorney and IP attorney. So but I'm not going to talk about legal like topics, but I'm going to talk about as a lawyer, but also I'm very deeply involved in actual development and business and then how actually that you can see that and the what it be the for example that I will give the good example about when you're developing digital health product, right? Based on digital health technology, then what will be the base where if you think about that whether if it is not just like you think about the whether this product should be under regulatory scrutiny and if yes and then what's the best strategy. So I will give you some example that in the like a life cycle of the development for the specific like digital health product and particularly in FDA in the clearance step. And then I'm going to talk about some example about recently they talk about in the legal term like a software as a medical device and AI and ML enabled medical device. So and then I'm going to talk about how they actually can integrate with like reimbursement, like this has coding and coverage pathways. So I hope to see you next week. Okay, so I done everything. So I will, I think that we have about 5 minutes more to go. So is there anyone to have any question or comment? Anyone can just share your insight or comment, whatever, for 5 minutes.
Yeah, Alex, thanks for putting that together. A lot of interesting information there. Do you have any sense of how this is shifting the burden, either from the care perspective and the labor involved in that, or from kind of the reimbursement and paperwork perspective to the caregivers who are cohabiting that home, with the patient?
Oh yeah. So actually, you've seen many cases actually the in the my presentation and video talk about that, right? Because for example, the hospital at home, actually the usually I'm not the good at like a hospital operation, but usually hospital is operated by the number of bed, right? So actually the if the capacity is more than actually the is like emergency situation in the government level interrupt of that. So this kind of hospital at home program actually bring your service to the home. So there is a lot of the like remove the burden to the current healthcare system, especially healthcare professionals, right? And then because a lot of the burnout. So there is some way actually, for example, the digital health can power you as a provider or the patient. Actually, they can improve your situation dealing with some your everyday work. So yeah, definitely there will be a lot of helpful. And then for that's why because that the reimbursement is based on that I mentioned about three challenges. Usually the healthcare, the three challenges is a cost and the benefit and accessibility. So accessibility is somewhat in the public like concern. But anyway, so if some new system or new service or your technology can bring to the table that actually can dealing with to these three matters, then the government, the or the like the payers will welcome that. That's one example. The hospital at home actually they have that low cost and bring more care, and so the value and then accessibility through this kind of like a digital technology to the front line. So that's the way, and then another thing that I'm thinking about is because you already seen that they are currently focused on acute care because they are related to some emergency situation and hospitalization matter. But I think that but they can actually like extend it to the chronic care, particularly for the like a lot of the like digital health solution also very strong in the chronic care provide. For example, that DTX case that I found that a lot of the like the startups are now they're innovating in the chronic like the health condition type. So, but that's one actually the also good to know is that, for example, RPM and another type of the RPM is remote therapeutic monitoring. They already have a CMS code, so they can have reimbursed. And also, I know that there is another one is like a chronic like health management has their own separate code. So even not this kind of like a coercive effort through the CMS type program. Actually, why not? If the hospital can, for example, hospital, they also like think about profit. So if they provide more care with the low cost, and then they can be the more better in the ROI. And why not? They can extend this program to be not beyond just active care, but the bring to the chronic care. Then there will be more opportunity to be this digital healthcare can be like included in the everyday the mainstream healthcare process.
Yeah, thanks.
Okay. Yeah, mental health. Yeah, mental health. Yes, yes. You know, because but look at the what the currently the most the innovative happening is actually the mental health, right? Because the mental is particularly is very difficult area. For example, that because of the reason that I produce a lot of the relate like a digital health solution related to mental health care. So for DTX, for example, that over like a 200 startup, I found that more than 60 actually working on mental health area. And then that mental health area that I mentioned about is evidence-based one. So usually require the FDA clearance in the United States or the DIGA in the German, CE or in other country. But if you include other like they call well-being app, like just supporting your mental health, so like a mediation or the mindfulness. It's not seriously interrupt your intervention, but actually it seems to be help. There are tens of thousands app out there, so yeah, definitely. But the most serious problem that I heard from the professor in this area is that this professional is really there are not many professional in mental health area compared to the patient. So, for example, in the United States, as you know, that including minor mental health problem, there are many people are looking for some treatment in their mental health problem, but but the problem is that because the currently the professional is not there, so usually if you have a like appointment, it'll take a lot of time, and then they cannot be follow up because they are so busy. The professionals are so busy, so they cannot be take care of the what the current like more advanced way to treat the mental health, and then they cannot be delivering to the one patient in a more deeper level. So the rehospitalization rate is so high. So you see that this digital health technology with included in the hospital at program, yeah, definitely they can be most beneficial for the mental health area. Yes, yes. Okay, so Victor, so you mentioned that solution. So can you share more about just 1 minute, so then we can finish up? Yeah, Victor?
Oh, sorry, I have my laptop upside
Okay,
down.
yeah, yeah. Okay, so anyway, yeah. Hi.
Um, okay, so my last project was disruptive. I created an AI touch tone outbound to simulate a person, but it had to get through the touch tone and the wait times. So it reduced and assisted like major carriers with waiting on hold. So we are able to reproduce 18 phone calls a day. Some of those calls were like 1.5 hours. Um, since then, I've been focusing on the e-caregiver side. So my solution is actually finding clients, which I have because of the need. Um, it's not easy, but it's not too difficult versus trying to sell life insurance. People need home health. My two clients that I originally have, their parents also need help. And so we're starting with routine activities of daily living. They want to pay for the services like now. I told them just let's hold on. Let's just create a system first. This is AI tech. So today, because of Mr. Lee, I recharged my wearable watch. So I'm going to start messing with the Google side of the extracting data from like how many steps I take a day. I think I'll have more success on the Android side versus the Apple side. So that's where I'm trying to go and build from there and just have disruptive tech.
Wow, fantastic. Wow. Yeah. That's
Thank you.
one real life application of that the digital health technology to the mental health care. Yeah, wow.
Well, I figure if when I have a team, I have one lady in Boston who's trying to learn core AI. I'm using Google Dialogflow, Watson if necessary, which was my original. But with that, I figure once I get 100 clients,
Hmm.
it won't be hard to get funding or even just sell it. That's the and then move to the next health solution. So, or shop it to caregiver companies. That way it reduces any liability that I have to
Okay,
take.
yeah, good, good, good. Okay, so why don't we reconnect sometime to talk about in like some deep level whether we can be collaborate for your project? Okay, so is there anyone to final comment? Okay, so I recommend to attend it next week because I'm sure that you cannot here in any other place that I'm going to talk about because I'm very sure that because I'm very deep level understanding of the like the product development and then how they integrate the regulation and reimbursement. So I will give you my insight. I'm going to share like similar to what I've done today and a very deep level but clear understanding based on my legal and then technology knowledge. So this is the one actually this will be the first time that actually that I never touched the legal matter before. I'm an attorney, so I'm hesitant to bring the topic related to my attorney work. But anyway, this is not the legal work. Actually, that this is for the as an attorney to build that legal matter compliance and then and thus understanding what needed in the actual product development. So I hope to see you again next week. Thank you very much to attend today's webinar. So this webinar will be shared and then hope to see you again and have a nice day. Thank you. Bye bye.